Hello, everyone, and welcome back to Module 3, Topic 2. What is contact tracing? This topic is going to be very similar to last topic, except our objectives, our last one has changed to understand the steps of contact tracing. It's important before we move forward, if you look on the left-hand portion of your screen, when we say the word contact tracing, that is kind of, so to say, an umbrella term. It's like saying ice cream and then you have a bunch of different types: vanilla, chocolate, strawberry. Contact tracing is the general broad topic that is the certificate you're getting in contact tracing. Subcategories of contact tracing are case investigation, which we talked about in the last topic. Remember, a case is someone who definitely has been diagnosed with COVID, so we tell them to isolate. Now, contact tracing, these steps are going to be put into place if you are contacting the contacts of the cases. So that's what we're going to talk about in this topic is how do we proceed? What does our phone call look like, or our contact look like with a contact that we might advise to quarantine, or in some special circumstances we might advise them to isolate. There are 4 main steps in contact tracing, and we're going to go through each of them in depth. Our first step is the rapid notification of exposure. A close contact should be notified of exposure within 24 hours of contact elicitation. It's very important that the identity of the patient/case or any identifying information may not be revealed. This is a confidentiality issue. We cannot disclose any names. The patient, however, can contact their contacts if they would like. So, for example, you get off the phone with, your mom. Your mom has COVID, and she knows that she's been in contact with her children. She has the right to go ahead and contact her children if she'd like. But you, as the contact tracer, when you're contacting those children, you cannot disclose that the person that they were in close contact with was their mother. Every effort should be made to reach contact remotely before attempting in-person communication. That means you call the person, you text the person, you email the person. Maybe you set up a video conference, anything before actually going to these contacts' homes. Step 2 is the contact interview. The interviews need to be conducted in the patient's language. And you never want to use a family member as the interpreter. This situation comes up a lot. Whatever jurisdiction that you are employed with, there's going to be some kind of protocol for using an interpreter in different languages. You will find that out when you start working. You are going to ask critical questions when you're interviewing these contacts. Your main steps are to assess the symptoms. Back in Module 1, we talked about severe versus non-severe symptoms. That's very important. Better categorize their underlying risk for infection. In the Module 2, we talked about those that were at high risk. Assess home and social factors that could impact compliance with self-quarantine. This is when you might have to provide extra services to your contacts who cannot self-quarantine on their own. Now, There's also protocols to advise what the contact should do, dependent on their symptoms and also dependent on if they actually had a positive COVID case previously. This has recently changed with the CDC. This slide and the next few slides are very important. Let's start with this slide. If the close contact was not diagnosed in the past 90 days, if that person has no symptoms, you're going to advise them to self-quarantine for 14 days, and they're going to be referred to testing immediately. Now, it says self-quarantine for 14 days from their last exposure. Remember that you cannot disclose the case's information to these contacts. That information should be in the system so you can tell when that person would have had contact with the case. Close contacts with symptoms immediately self-isolate. So this is the one specific instance where you're going to advise to isolate instead of quarantine with a contact. And these people are also going to be referred to testing and medical care. So let's pause for a few seconds here and read this slide. To sum up this slide, if a contact was not previously diagnosed within the past 90 days with COVID, if this person has no symptoms, they are self-quarantining for 14 days and being advised to go get tested. If this person does have symptoms, they're going to self-isolate. We refer them to testing and to medical care to get a medical professional's advice. On the other hand, if you're talking to a contact who was diagnosed with COVID-19 in the past 90 days, if this contact has no symptoms, they do not have to quarantine, and retesting is not recommended at this point. If a contact has symptoms, they should self-quarantine for 14 days, consult a medical provider. However, testing is not really recommended because even if they're tested, we're still going to recommend that they quarantine for 14 days if they have symptoms. So let's pause for a few seconds to read this slide. To sum up this slide, if a contact had COVID within the last 90 days, if this contact has no symptoms, they do not quarantine, they do not test. If this contact has symptoms, they should self-quarantine for 14 days, consult a medical provider, and we're not going to advise them to retest. Their medical provider might, but we're not going to. All close contacts should be advised to be tested if testing capacity permits this in your jurisdiction. So this is going back to the last slide. We're first going to see if we're recommending testing, and if we are, we're recommending it to all of those. Now, in the past, testing wasn't as available as it is now, and it might not be as available a few months from now. We don't know. But if the jurisdiction permits everyone gets tested. That's recommended for tested. If not, then it goes by a protocol, and your jurisdiction would have that too. So for example, high risk patients, those in the healthcare field, those first responders, people like that, they're going to be the first to be advised to get testing. If the test is positive, then the contact is referred to case investigation, because now they do have a positive test, and then they have to go through the case investigation protocol. If negative, asymptomatic, they should quarantine for 14 days. If negative, symptomatic, you quarantine for 14 days, and your healthcare provider might be advised to get a second test if the symptoms don't improve. And then if you cannot get tested and you have symptoms, you self-isolate for 14 days, and you basically treat yourself that you're a case. What do you tell someone who is going to be in quarantine? Well, what self-quarantine means is that they are at home if possible. That's always the number one place to self-quarantine, is in your home, until 14 days after the potential exposure. Follow all CDC guidelines. That means staying 6 feet away from others at all times. Self-monitor your symptoms. Take your temperature twice a day. Watch for fever, shortness of breath, cough, really any other symptoms that might come up from the symptom list we talked about earlier. Contact a health provider immediately if you have a fever over 100.4 or higher, develop a cough or shortness of breath, or develop mild symptoms like sore throat, muscle aches, and tiredness. And most importantly, avoid contact with people of high risk. One other thing that you might want to educate, now face coverings are required in a lot of places. It probably would not be a bad idea to recommend a face covering if they're living with other people in their quarantine household. Assessing self-quarantine support needs. Self-quarantine requires that a contact stay in a specific room from other non-exposed people and pets, ideally with access to a separate bathroom. This is the ideal situation. We all know that this might not happen to everyone we're speaking with over the phone. So we need to see what we need to do to support these people who are going to be in quarantine. This is a checklist. It's going to be available in PDF form after this video. You can check it out. Support services. Here's some examples. All contacts will receive the COVID kit as mentioned in the previous presentation. We might need to assess food and pharmacy delivery, laundry services, garbage removal, financial considerations, and care for persons with disabilities. Case resource coordinators will provide these resources to the patients/contacts. However, if it's not funded, it does fall into the contact tracing protocol that we provide patients, contacts with the access to these resources in case they need them. Out-of-home isolation or quarantine. You may need to refer to alternate housing. And this is the case for those high-risk situations, such as those who live in homes with multiple generations, those that are being released from a correctional facility, those that are homeless, healthcare workers, persons with high-risk populations. Step 3, medical monitoring. Contacts who agree will receive daily monitoring through real-time communication methods. If the jurisdiction does not provide this, then we're going to advise those people to self-monitor, which is we're going to give them a monitoring log or in some cases, there might be technology provided, like an app where they can log their temperature and their symptoms and everything like that. And for contacts who report symptoms will be linked to clinical care and testing. Step 4, contact closeout. Asymptomatic contacts who remain asymptomatic after 14 days can be released. Contacts who develop symptoms but test negative should continue to quarantine for those 14 days. A second test may be issued. You're going to follow the local authority on their protocol. Releasing someone from quarantine gets a little bit more complicated than isolation, because in quarantine, those contacts might not develop symptoms. They may, and it depends when they start developing their symptoms. And are the symptoms getting worse? Are they getting better? Did they have access to go get a test? Was their test negative? So on and so forth. So you just kind of treat each contact as a different case and follow the protocol that the jurisdiction is following that you're working for. So again, contact tracing is crucial to prevent the spread of infectious diseases. Here's our review of the contact tracing protocol. I'm just going to leave this up here. Go ahead and take a look. All right, that is the end of our topic. Here are the websites available. If you would like any further information, remember everything is taken off the CDC, and these protocols are always constantly being updated as we learn more about the virus. So I will see you in the next topic.